in honor of World Maternal Mental Health Day today, the Prenatal to 3 initiative will be having a presentation to share with you about addressing perinatal mental health needs to support first-time moms. Following the presentation, we have a person here to share about her lived experience. And then following that share, we will open it up for some questions, and feel free to include it in the chat box directly to me, Kristen, or I have some questions too that I can present together. And following our question and answer time, we will actually have a presentation on infant massage. So you first-time mothers can learn the massage techniques with your little one. Thank you. And I would like to present Yvette. I want to make sure that we do recognize there's a media notice. Sylvia, if you could please share that.
Absolutely. I will share it right now. Is it okay to make the announcement?
Yeah. That one's in Spanish. If we could put this in English, and today this is the English recording, and then we will do a Spanish one at 2 o'clock.
I apologize.
That's okay.
Grabbing that now.
We want to make sure that we provide it for everybody's reading, even if you're watching this on a separate day.
All right, everyone, thanks for your patience. Just to let you all know, we are recording this event, and this is our media notice that in summary says that the county may record and post this recording on our social media and other online platforms. So thank you. And if you do not, oh, sorry, one more thing. If you do not want to be recorded, you're welcome to turn off your cameras and change your username. Thank you.
Thank you for sharing that. And if you do have questions about how to change your username, there's 3 dots above your picture or your name there, and you can press to change your name. So with that, I would like to introduce Yvette Huerta. She is a licensed bilingual Spanish-speaking marriage and family therapist who specializes in infant and early childhood. Her training and experience revolves around parent-child relationships, family dynamics, postpartum depression, mood and personality disorders, communication, and families and children who have experienced various historical and relational traumas. Yvette has worked with the prenatal and postpartum population for over 24 years. Her extensive training consists of working with infant mental health and developmental care. She is certified in working with medically fragile and premature babies. Yvette's training and experience has taught her how to embrace the importance of relationships between a parent and their child. Identifying a child's emotional and psychological cues will not only support their development, but increase the bond and relationship between parent and child. So with that, Yvette, please take the microphone.
Thank you, Kristen. Welcome, everyone. I'm so happy that you're able to join us today, or maybe hopefully you get to see this live, or possibly when you have time, just press play and you're able to listen to a little bit of what our team does here within the County of San Mateo, which is called the Prenatal to 3, as well as what we really want to focus on this month of maternal mental health, and really focusing today on explaining just really very short discussion about perinatal and postpartum depression. And then we will have the opportunity to meet somebody who has lived experience, who could share a little bit more about that. So with that being said, Sylvia, can you start? I have a PowerPoint that I'd like to share. Thank you. First slide, please. So here are some images that you could see as when we talk about pregnancy and this imaginary pregnancy that you have when you first find out you're pregnant. People think of unicorns and rainbows, and here's a picture of this, this woman in this field and how it's going to look so beautiful and feel so beautiful, and you imagine your baby, right? During this pregnancy period, what's called the perinatal period. And then reality kicks, the baby's born, and it's not as easy as what we thought it might be, right? You have all this imagination of how it's going to be, but it's not as easy as it's going to be, right? There might be some sleepless nights. There might be some times where you're absolutely exhausted, sleep deprived. There's this thing called breastfeeding and having to pump, something that you really didn't think about when you thought about taking on this role of being a mom, a first-time mom, really having to take on the role of being a mother in this new role of a new identity of who you are as a woman. So there's a lot being in place when we take on the role of motherhood. Next slide, please. So I want to explain to everybody what perinatal depression is. So a lot of people automatically jump to postpartum depression, but it does begin in the perinatal period. So perinatal depression includes depression during or after, during pregnancy or within the year after the baby, it's the end of the pregnancy. Depression is one of the most common medical complications during pregnancy. In the following year, it affects about 1 to 7 women. So most of the time, like I said, people think that postpartum depression is the only thing related to experiencing some sort of depression during this period, but it does begin during the perinatal period as well. Experiencing depression before or after the birth of the baby is not unusual. Actually, it's very common. And a lot of people, what they do experience is something called baby blues. And we'll talk a little bit about that. And you've probably also heard the terminology, and I've mentioned a few of them here: postpartum depression, maternal depression, prenatal depression, postnatal depression, or perinatal depression. It all encompasses everything all together in regards to depression of a woman who has experienced it during pregnancy or after birth. Now, when we talk about depression, there's different levels of depression. There could be mild depression, there could be mild or severe, and we'll talk a little bit more about that. Next slide, please. But before we talk about that, let's talk about what a lot of people have probably heard about, which is postpartum depression, also known as PPD. And it's what really a lot of women experience after having their baby. A lot of people don't realize that actually postpartum depression is a medical condition that needs treatment. A lot of the times, a lot of the women, for example, that do come into our clinic think that it's just part of pregnancy or postpartum, that you are supposed to just experience this and that it'll go away. But in reality, it's a mood disorder, which is really caused by some sort of hormonal changes that really are affected through your neurotransmitters, through your brain and throughout your body. And then in turn really just impacts the stressors and every psychological organ that is really contributing to everything throughout your body and your daily functioning. So sometimes people have shared that they feel that's impacted their relationships, their living situations. It makes it difficult for them to be the mother that they really, really want to be, or to care for their child the way they really feel that they can. Symptoms can last from 2 to 3 weeks, and they really peak within that 8-week period. That's why it's really important when we remind people to go and see their doctor or their obstetrician after that period, because that's during the time that it's really important for you to be able to come in and talk to somebody to see if you might be experiencing postpartum depression. Because little did people know, and now that we have more research, the symptoms can actually last for about a year. Next slide, please. So let's talk a little bit about what are baby blues. So baby blues are the most common type of mood swings that happen after birth. It's not uncommon, and it's less severe than postpartum depression. It actually occurs within 70 to 80% of the mothers experience it, and they really just didn't even know that they experienced it, because it could come within 4 to 5 days after the baby's born, and the symptoms might last for about 1 to 3 days. 3 weeks, and then they're gone. Next slide, please. Some of the symptoms associated with these baby blues are with, moms start saying they feel very impatient, very irritable, they're weeping, sad, some sort of anxiety, struggle with concentrating. They can't remember where they left their keys. They can't remember, if they had fed the baby, that feeling of dependency, something they never really experienced before. Tremendous amount of fatigue, even more insomnia. They're not able to sleep. They can't get the sleep that they could before. And these uncontrollable mood changes. Next slide, please. So then people ask, what are the causes of baby blues? Why does this happen? Why is this happening to me? Why is this happening to me so quickly? And the reason why is because your body, after giving birth, which is actually it's a traumatic experience to a woman's body, there's going through rapid hormonal changes. There's physical and emotional stress after the birth of a child. There's physical discomfort that could happen either if you have a vaginal birth, if you have a C-section, if maybe you were induced, if it was a difficult pregnancy. There's a lot of discomforts that happen sometimes. Or there's an emotional letdown that is not the pregnancy that you thought it was going to be. You had this idea of how you had this birthing plan and it just didn't turn out the way you thought. Or birth awareness, all of a sudden you think, oh wow, I actually am a mom, I actually have a baby, oh my gosh, what's going on? And with that in turn, the anxiety and then about this responsibility kind of kicks in. And then of course you still have that fatigue and sleep deprivation. And then sometimes people say, the disappointment of that, this is not really how I thought it was going to be. My partner or my spouse or my family, it's not supporting me. And another one that's very common is breastfeeding. Breastfeeding could be very tough and it's not what people thought it was going to be. And then all of a sudden, you're not able to breastfeed the way you thought you were going to be able to. And that could be a big letdown. Next slide, please. So we talked a little bit about baby blues. We talked a little bit about perinatal depression, but let's focus a little bit now about postpartum depression. Okay, so what are the symptoms of postpartum depression? Here's a list of them. Some of the moms that come into our clinic, they start saying they're feeling this sadness, this depression, they're crying, but it's not weeping. It's this uncontrollable crying that just comes out of nowhere. This intense anxiety that maybe they felt before, but now all of a sudden it's really uncontrollable. The loss of pleasure or interest in usual activities, things that you really enjoy doing just don't seem as pleasurable. Going for that walk, having that cup of coffee, listening to music, dancing is not the same for you anymore. There's a feeling of guilt and worthlessness or feeling incompetent, feelings that you've never felt before kind of resurfacing. Like we talked about before, there's fatigue, irritability, sleep disturbances, and poor hygiene. A lot of moms come in and sometimes they say, I just don't even have the energy to brush my teeth, to comb my hair, to take a shower. I just don't have that energy like I did before. What is going on? And then a change of appetite. Either some moms say that their appetite goes skyrockets, or some of them plummet and they just don't have the appetite that they had before and they get concerned because they need to take care of their child. Poor concentration, forgetfulness, can't remember anything, you can't focus. Feeling inadequate to cope with the baby. This is maybe I'm not right to be a mom. Maybe this isn't what I'm supposed to be doing, right? Feeling worry about the baby or baby stuff. This is a lot of times, sometimes all of a sudden you're just holding the baby and you're afraid like the baby might fall. Maybe something's going to happen to the baby. Did I did I swaddle the baby too much? All these ideas and thoughts that you never thought would ever come across your mind are all of a sudden coming to your mind. And last, and sometimes it does happen, we do have some moms that do experience some suicidal ideations, meaning thoughts of harming themselves. And that's when that's most of when we get those calls where I'm like, I need help. I need help. I've never had these thoughts before. And all of a sudden they're coming to my mind and I really need to talk to somebody. Next slide, please. So a lot of people say, what causes this postpartum depression? And researchers have shown that usually mothers that are younger than 20, usually some of our teen moms do experience postpartum depression. Also, You know, there's this sometimes when you go into the doctor's office, they ask you to do all this blood work, you know, during your pregnancy period, during your postpartum period, and there's a reason why, because they want to check your thyroid level. Sometimes low level of thyroid hormones could actually lead to depression. And little do you know that you do have a low thyroid, and that might be a cause of why you're feeling depression. There might also be you've experienced depression in your past. Maybe something that you forgot about years ago, all of a sudden are starting to resurface. Maybe your own mother or your own aunt or someone in your family has had postpartum depression, or there has been a history of depression. Mothers who are not sleeping well enough or not sleeping at all is a big, big red flag. And that might be a reason of why the depression is kicking in. And last but not least, stressful events in your life. And right now, in particular, everything that's really going around during this pandemic is a big, big stressor. Lack of housing, lack of food, financial stress, you know, not being able to have the family support, being isolated, all of that is a really contributing factor sometimes for postpartum depression. Next slide, please. So I thought it'd be nice to kind of look at this grid to kind of give you an idea of what pregnant moms might experience during their pregnancy, and what might look like normal type of pregnancy related symptoms versus what might really be depression during pregnancy. So for example, tiredness and energy level most definitely is impacted during your pregnancy. And it's normal to get easily tired, maybe want to take a nap, and you rejuvenate and your energy gets back, right? But when a woman is experiencing perinatal depression, it doesn't matter how many naps that they take or how much they rest, they just still feel that overwhelming fatigue that just won't go away. Or their ability to feel pleasure, like I mentioned before, things that you just used to have pleasure, maybe sometimes may bother you, you know, this pregnant mom, or, you know, they kind of go away, that the things that they used to look forward to aren't there, but then they come back. When you have depression, it's a little bit different. It lacks complete lack of ability to feel that experience of pleasure. You may not even look forward to thinking about having a child. Appetite. You know, a pregnant mom, is normal during pregnancy, her appetite increases. During depression, sometimes it might typically decrease. And that's sometimes a red flag for some of the obese, because they really want to make sure you're getting enough nutrients, not only for yourself, but for your growing child. Self-esteem. During pregnancy, usually sometimes, you know, yes, your belly might be getting a little bigger, and your pants might be fitting a little tighter, but your self-esteem kind of remains the same. For when a mom who's perinatally depressed, her self-esteem goes down, and it stays down as long as she's depressed. Next slide, please. Guilt. Sometimes, you know, during pregnancy, guilt is not really a contributing factor, but someone who's experiencing perinatal depression, it's something that just comes on for no reason. It's just this overwhelming sense of guilt that just comes out of nowhere and won't go away. We talked about insomnia. I think I mentioned that the most because that's one of the biggest red flags that we get when we have a lot of the referrals that we receive, or the clients that we work with in our clinic. A lot of the times, you know, during pregnancy, it's normal to be going to the bathroom all the time, and you can't go back to sleep because your bladder's full, but then you go right, once you use the restroom, you go back to sleep right away. When you experience perinatal depression, it's not like that. You just can't go to sleep. You try and you try and you try, and you may never go back to sleep, and you never sleep the same. And sometimes you wake up early and you stay awake. And sometimes you might only sleep 2 to 3 hours. And we know if that happens time after time, week after week, it starts really impacting the mother. And then there's also self-destructive suicidal thoughts or plans. Sometimes during pregnancy, this doesn't come up at all. But for a woman who's experiencing perinatal depression, they often sometimes do have these thoughts that come and go. Next slide, please. So who can experience perinatal depression? Perinatal and postpartum depression. So research shows And most of the clinicians on our team can speak to the fact that depression can impact any woman of any race, age, color, social and economic background. It could occur within pregnancy or birth. Without treatment, symptoms may last for a few weeks, months, or they might last up to a year. But we have come across moms that do experience that depression longer than a year. Depression may emerge in women who have had healthy pregnancies and who have never, they always wanted a baby. This is everything that they ever thought was going to happen. They never thought that this would ever happen to them. And then all of a sudden they experience this perinatal and postpartum depression. But I want to make it clear, depression is not a sign of you being a poor parent, a poor mother, or a poor human being overall. It's just a sign that you have a medical condition and an illness that needs attention. Just like diabetes, just like if you were to have a heart condition, anything like that, it's a disease, that needs attention. Next slide, please. So just a little information here, the reality of postpartum depression, 50% of the cases go undetected and 15% of them are new mothers. So that's a big number to kind of look at. Postpartum depression, like I said, is true for all women of all countries, cultural groups, religion, affirmations, level of education, and social economic status. Depression will hit anyone. Okay, it doesn't just individually pick out certain people. Okay, postpartum depression is more common, believe it or not, than gestational diabetes, preterm delivery, and preeclampsia. And researchers show that months both immediately before and after giving birth are the times that are most valuable and most that we really need to focus on whether or not to see if someone does experience postpartum depression. That's why I stress that it's important for you to stay connected with a support group, with your doctor, with anybody within with your bubble that might help you during this time. And, lastly, when people say, oh, it's a very hormonal type of thing, it is, because like I mentioned before, giving birth and having a child does impact not only your body, but it impacts your brain, it impacts your hormones. Estrogen and progesterone levels plummet, and they're way below. They get way below than they did during your pre-pregnancy period. And the cortisol level increases, and by the end of the pregnancy, it drops after you deliver. So what does that all mean? It means that your body is going through some hormonal changes that are impacting you, not only just within your body, but within your daily functioning, within your thoughts, within you being able to make a decision. Overall, it's affecting your well-being. Next slide, please. So with everything being said, what's the treatment for perinatal and postpartum depression? What we really encourage you is to find a therapist or counselor that specializes in postpartum depression. When you find that individual, develop a wellness or a safety plan. When we talk about wellness plans, we talk about maybe thinking of things that might help you get out of your home, get out of isolation, reconnect with individuals. The safety plan, when you're starting to have those thoughts or ideas of harm, who can you reach out to? Who could be your support system? Attending support groups. There's a lot of groups out there that really, really can support you during these times. Consult with a psychiatrist. I know a lot of people don't feel very comfortable about talking to a psychiatrist because of the taboo of medication. But if you were to come to our program and talk to our therapist, as well as consult with maybe some previous clients that have been with our program, or you've met people before out there and they've talked to you, medications do help you get over that period. It's a period where maybe you might take it for 3 months, 6 months, or a year, but it's just something to help you along the way. But what we always recommend is therapy and medication is a good combination. Next slide, please. And lastly, how to treat or cope with perinatal postpartum depression. Like I mentioned, treatment plans are different for every woman. And what I mean by a treatment plan is what you come up with that works best for you. That might include self-care, meaning maybe making an effort to go for a walk 3 times a week, maybe taking a bubble bath, maybe painting your nails or getting your hair done, maybe getting a massage, right? Getting your social support kind of in place. Talk therapy. Talk therapy helps sometimes, or counseling overall. And lastly, medication. But like I stressed, self-care includes proper rest, good nutrition, because this will help you. And like I tell a lot of my clients, it helps you be a better mother so that you could be the best mother that you want to be for your children. Because with you being able to taking care of yourself, you could take care of your child the way you'd like to take care of them. Support systems, I really think are important because it's important to connect with people, maybe through text or maybe even picking up the phone and talking to him or he or her like they were back in the days, right? Or maybe just being able to talk to somebody that might be able to give you a little bit of encouragement. Like I mentioned, talking with a counselor or a therapist who understands perinatal mood and anxiety disorders, as well as postpartum depression, is very, very, very beneficial. And lastly, maybe thinking about taking medications to help you address some of those anxiety and depression that can't just easily be resolved through talk therapy, because sometimes medication helps you kind of put link into those missing hormones that sometimes impact, like I mentioned, not only our brain, but our body. So with that, my portion is over.
Thank you so much, Yvette. That was a great presentation, and you have such thorough knowledge, and I'm just so glad to be a part of this team with other clinicians that have this experience to work with moms. And, one of our people here today would love to share her experience. Angela, if you could unmute yourself and share about your lived experience with us. And then after you speak, we can answer some questions.
Okay. Am I unmute? Did I unmute?
Yes.
Okay.
You're perfect.
It's funny because everything that you just said in that slideshow, I realized that I've learned over like the past 5 years with you guys, like put your oxygen mask on first, or you can't help your kids type of thing, or the sleep, or there's so many things that I've learned. I'm so thankful that you guys have been in my life because life happens. That's what happens. And I never saw it coming. I thought my children would actually be born, it's what, 8 months, because that's when twins are born. I'm a mother of twins. So, and they lasted 9 months in one day. I begged them to get them out of me at the hospital. Like I'm running around and I haven't slept. I was like, just get them out, man. And then I realized now they're out. What am I going to do? My gosh. And now I can't breastfeed because I'm so stressed out. And I didn't realize that was possibly postpartum depression, but all my blood tests came back fine from 4.5 weeks. So I'm just realizing exactly what you taught me is getting right back into my head. All the things that you guys have told me throughout these years still echo in my head, and everything and everyone that you've hooked me up with has taught me when I'm teaching my children something. I think back about, oh wait, maybe I haven't had enough sleep. Maybe I'm going off. Maybe something's wrong here. And there's so many things I could say, but I don't want to talk too much because I could go on for hours about how much you guys have helped. Thank you. I wouldn't even be able to speak here right now, actually, if it wasn't for Cindy and Andrea's help. And Lydia. So thank you guys.
Thank you, Angela. That's wonderful to hear. Yvette, did you?
No, I thank you, Angela, for sharing your experience. Thank you.
You guys have been great. Thank you so much.
And I think your point, like you said, you wouldn't even be able to be here without some of the support that you got, and to know that your team members are still a part of the team is wonderful. And so some of the questions that you might have had, like you said, your blood tests were back just fine. you felt weird but didn't know what was going on. So one of the questions, if I don't see any other questions in the chat, but I do have some questions of my own to kind of add. Yvette, how do you know when to reach out for help when you're feeling down before or during pregnancy, before pregnancy, or before birth, during pregnancy, all of how do you know when?
I think that's a great question. And that's a lot of, I think if you start experiencing some sort of depression or anxiety, I think I always tell my clients, it's a given, right? Anxiety and depression, we do, believe it or not, you do experience that. It comes and goes. However, as a woman, especially when you're pregnant, your hormones start changing, right? Your brain is changing. Your body is getting ready to go through, believe it or not, a big traumatic experience because your body's going to change. And then all of a sudden, you just don't feel that joy, that happiness, that sense of pleasure like you did before. And as time goes on, especially, like I said, the time to really, really focus on, and maybe Angela might speak to this, is during that 8-week period where all of a sudden that anxiety and depression shoots up. And all of a sudden you can't function like you did before, or you start having these overwhelming anxiety and thoughts that you just all of a sudden feel like you need to talk to somebody about it. But who can you talk to? And that's why it's important to follow up with your OB, or to seek, or go out and seek support, because the OB will be like, okay, let's take some tests like they did with Angela. Let's make sure everything's okay. We ruled that out. But you know what? I'm still not feeling all right. I'm crying. I feel like I can't concentrate. Well, you know what? Let's connect you with somebody that might help you out. So when that's when you might make that call, or we might call you to see if you might need support. And I think that's how we got connected with Angela.
I wanted to tell you, I want to say that anyone that's listening, I was really hesitant to actually reach out because I didn't think anything was wrong. All my tests came back fine. I don't have postpartum depression. I've been planning this. I'm prepared. Everything's fine. Even though I probably wasn't, thinking back. But the thing is I've learned that I can trust you guys and everyone at Prenatal 3. And I've been able to actually help myself and in turn help my children and our entire life just because I can trust you. So that's really, really big because it still helps me like to this day. So I'm very thankful, and so are my kids. Thank God they're at school right now.
Good.
Yeah, because I tell a lot of our first-time moms or our parents that come our way, you're not given a book and say, here, this is what you do, and this is everything that you need to know is in this book.
I read them all.
Yeah, right. It doesn't work that way. It doesn't work that way.
Rip them up.
And you could look at it and you're like, this doesn't make sense to me, right? Absolutely. But you said something that's very important, Angela, and I think that's something that a lot of us should always remind ourselves and our clients and anybody we come across. You need to take care of yourself first. You take care of your self first, because if you take care of your self first, then you're able to take care of your child. Because then if you're lacking sleep, if you're lacking some sort of rest, food, all what seems to be appropriate, then you're not able to then take care of your child the way you'd like to.
Absolutely. I think it's really important that you guys know, and everyone knows, that I didn't even want to come to therapy. I was kind of forced into it. And I'm so thankful I was. So, because I didn't know I needed it and I didn't think I did. But it's a great thing that I met you guys, because without you guys' high help and guidance, I wouldn't be able to tell my children, guess what? You have to go to sleep today, because sleep makes you healthy.
Absolutely.
Okay.
Thank you guys for answering that question together. I like that kind of answer. I do want to ask maybe one more question. I think we have time before we do an infant massage. Is, when you are maybe in treatment with a therapist and there's that recommendation to maybe talk to a psychiatrist and they recommend medication, what if you're breastfeeding, or what if there's a medication that is recommended to you? Can you still breastfeed and take medication at the same time?
Thank you for asking that question, Kristen, because I think it's important that it's something that needs to be part of, an option. It's kind of the cards. You put your cards on the table and you kind of review them and see if maybe medication would be one part of your treatment plan. And absolutely, find within our county, we're very fortunate that we do have an adult psychiatrist who specializes in women's health. And she's actually helped she's actually trained and really consulted with a lot of the psychiatrists and OBs throughout the county in regards to psychotropic medication during pregnancy and during the postpartum period. Because while you're breastfeeding, there are medications that you can take. And she would prescribe those to you according to what your needs are, according to what your symptoms are and what your plan is. A lot of moms choose to breastfeed throughout that first year or longer. Or sometimes some moms, I could put myself out there, breastfeeding was not easy for me. And it became something that I decided was just too stressful and I wasn't enjoying it. So I made the decision to not breastfeed so I could enjoy my children. And there's a lot of parents that feel like that sometimes as well. Medication also is not addictive because the type of medication that is prescribed is specifically for what you need at that time. And a lot of it is really thought out by the psychiatrist on what is the need of the client.
Great. Thank you for sharing about that. I really enjoy the dialogue that we've had today. And knowing that we have the same dialogue during sessions with
Absolutely.
the psychiatrist amongst ourselves as caseworkers and during groups.
Right.
And one of the other things that we're able to do together at Pre to 3 is sometimes learn new skills. And we have Cindy Donis and Hedwig HDeOcampo here to share with us a little bit about how to do infant massage. It's going to take about 5 or so minutes. So Cindy and Hedwig, if you want to take the screen and microphone.
Thank you, Kristen. First off, I just wanted to say today is Mother's Mental Health Day. And so wanted to acknowledge all the mothers out there. And I know sometimes we have questions or second guess ourselves. And I just wanted to say you guys are all amazing mothers. So just remember that when you have the hard times that you're doing a good job. So before we proceed on the infant massage, one of the pieces I just wanted to share a little bit about is that, we're going to demonstrate the infant massage strokes to create bond with your baby. Infant massage does have several and many benefits for you and your baby. So I'll just say a few. One is to really connect with your baby. Secondly, it also helps baby sleep as well as your sleep when you do infant massage. And secondly, or I should say thirdly, there's also teaching your child boundaries. So when we actually provide infant massage, we always ask permission from our babies. And I know some parents are like, how do you ask a baby permission? So, we'll show that briefly to with you all. But it's really important for us to really respect our baby's boundaries and ask permission. And so there are cues that our babies have. So of course, if the baby is looking away or crying or falling asleep, those are not necessarily the time that we would be actually providing infant massage. Usually when you have an eye contact and you see, the child has energy and is engaging, then those are the times that you would offer the infant massage. So I just wanted to name that. Secondly, I know all of us like massage, or most of us like massage. And so I just wanted to name that massage is not a 50-minute session. It could be 10 minutes to 15.
How long do I massage my baby? Or, and I think that that's where we allow the baby to guide us. And that we look at the baby's cues. And if the baby is looking at us and cooing and their muscles are not resisting, then we know that that baby is ready for massage at that moment. And then the other piece is, if the baby enjoys it and then begins to fall asleep, that's when we would begin to probably wind down our massage as well. So I'll let Hedwig continue.
So one of the pieces that, we do is we're going to, if you're able to reach for a doll, or if you're able to have your baby next to you, we will proceed in doing a little bit of infant massage strokes.
So the first area that we'd like to massage, and we're going to show you 2 strokes on the legs, and we're only going to do one side, but for your baby's sake, do both sides, right? So that they can feel a sense of balance. And we usually start by just, after we've received permission and, our baby is saying yes, they're not crying and they're not asleep, we want to just kind of gently touch the legs and say, this is where we're going to start. And babies learn routines really quickly. So once they feel that a few times, they know a massage is coming. And the first massage, we like to call the C cup. So I always say, sorry, I'm like trying to put my hand, I always say, make your hand into a C. And you're gonna, with your other hand, lift their little leg, and you're gonna start at the chubbiest part of their thigh, and you're gonna glide upwards. And our recommendation is that you do this skin to skin. So you can remove their clothing, and you just kind of do a few strokes upwards towards the feet, so away from the body. And depending on your baby, they might want a little more pressure, or they might want it to be a little lighter. So you know your baby best, and you'll see what your baby enjoys. And then you would switch to the other side, and you would repeat the same thing here. And legs are the area of the body that most babies enjoy. So they love getting their legs massaged. The second massage is that we're going to hold the chubbiest part of their thigh, and we're going to roll it. So pretend like you have a little chunk of Play-Doh in your hands and you're just rolling it. And then you're going to gently stop rolling, and you're going to move to the calf, and you're going to roll the calf area. And when you do that, you want to make sure that you avoid rolling on joints. So no knees and no ankles, just chubby areas. You roll chubby areas. And then you would go and repeat it on the other leg as well. So again, rolling like Play-Doh on each side. And then when we would be done with the legs, we would just say, all done. And that would give the baby a transition cue that you're done with this part of the body, and you might not continue. But if they want more, you can continue in other parts. So the other area that is very helpful to many parents is the tummy area, because when babies are feeding, they may have gases, they may develop colic, you may be switching from breast to formula, and all that can cause some tummy issues for the baby. So for the purposes of tummy massage, I want you to imagine that your baby's tummy is a clock, okay? And that way we don't have to deal with what's my right hand and what's baby's right side, okay? So here's a clock, here's 12. Here's 3, 6, 9, and 12, okay? So with your hand, you're gonna start right under the rib cage, and you're gonna go around the clock, okay? So this really helps, and we wanna always make sure we're going in clock motion, because it can help babies if they're feeling a little constipated, okay? So always going around in a clock motion. We don't wanna reverse it. And if your baby's okay there, you can keep massaging. And the other massage that we're gonna do is we're gonna start here. So remember that this is the clock, right? So this is 12, and if this is 9. So we're gonna start at 9. Again, going in that clockwise motion. So from 9 to 12 to 3. And essentially you're making a rainbow across your baby's tummy. So 9 to 12 to 3, okay? And the last one we'll do across that rainbow is we're going to press. So pretend that that rainbow is still there, and you're hopping and pressing gently. And this helps with gas bubbles. And don't be surprised if you hear some little noises coming out of your baby. That's normal, and that's actually a good sign of a massage. And we're gonna say, all done when we finish the tummy area. And that is a few strokes. Those are a few strokes for infant massage that you can use for baby. So always remember the clock, the rainbow in that clock motion, hopping across the rainbow, the C, the letter C going all the way up, and chubby rolling, okay? And repeat it as much as you feel that your baby might permit it. So thank you, everyone.
Thank you so much, Cindy. That's so calming. want to do it to myself too.
Actually, many mothers report feeling very calm themselves when they're engaged in their baby massage. And the other thing that they notice is a sense of empowerment, because maybe some strokes don't work, but maybe there's one stroke that calms the baby and they say, wow, there's something that I feel I can do to really support my baby. And then they're doing something that they both enjoy together. And one of the things I'll say is I taught this to my cousin when her baby was little, and now he's about 18 months, and he takes the lotion to her, leans over, and points to his back. So it's a good routine that once it's established, babies like to continue getting their massage.
So sweet. Thank you for sharing that story too. It's calming for both baby and mommy. And so thank you so much for sharing that. And thank you everyone for joining us today. And thank you, Angela, for sharing your lived experience. It was just wonderful to hear just how hopeful and just all the help that you got from the team here. And thank you, everyone. We are going to end our English group now, and appreciate you guys listening in and learning more. Please, of course, reach out to us or talk to your close support network to connect to us here at Prenatal to 3 Initiative. And happy mental health or maternal mental health day. Take care, everyone.
Bye, everyone.
Bye.